Welcome again, everybody, to a new session of oral radiology lessons. And in this video, we're going to discuss one of the important subjects in the interpretation of radiographs, that is in most of the cases it is overlooked, and this is the anatomical landmarks that are seen in the intraoral radiographs, and they, in my opinion, they are very important in understanding, or a basic understanding of the radiographic interpretation, because if we fail to recognize the anatomical landmarks, or the superimposition of structures, or the superimposition of soft tissues and air shadows on the radiograph that might mimic the radiographic appearance of structures, we might mix or might misinterpret anatomical entity as a disease. And today we're going to talk about the maxilla, the intraoral radiographic anatomical landmarks in the maxilla. This is a periapical radiograph of the upper, as you can see here, the central incisors and part of the lateral incisors. Of course, if you want to interpret any radiograph, whether for anatomy or diagnosis or treatment, you should have a radiograph of proper density, contrast, and sharpness. You cannot interpret an image that is that lacks proper image quality. As you can see in here on this central radiograph, I want you to have a look at this structure. I'll remove this animated part. Can you see this line over here that crosses the roots? I repeat back. See, have a look again. This line, this line, and all this area. Actually, this line marks the end of this area. This is the shadow of the ala of the nose. I'll repeat. See it here? This is the shadow of the ala of the nose. Of course, because the X-ray is coming at an angle, as you can see in here, it will pass through the shadow of the ala of the nose, and then the ala of the nose, being a soft tissue, a thick cartilaginous tissue, it will cast its image on the radiograph. So please, this is a shadow of the ala of the nose. I repeat. See, this is the shadow of the ala of the nose. Excuse me. Now, in the same radiograph, and in the same radiograph, you often see the crowns of the upper central incisors. They are not of consistent radio opacity. See, at this part, the crowns, they look more radio opaque than this part. See this area? Okay, and they are even less over here. Now, why is this shadow as if there is a hypocalcified area. See it over here? I remove, repeat. Okay, see this line over here? Actually, this is the air shadow, the shadow of air, let me say, that is present between the lips. When the patient opens, okay, this actually is the end of the lip. So what you see here, this radio opacity, is a shadow of the lip plus the enamel plus the dentine of the crown. While in this area, I'll show you here, this part, from this part downwards, what you see is the air shadow, which casts nothing, plus enamel plus dentine. That's why this area appears more radio opaque. So please, before you jump to wrong conclusion, is that we have some decreased radio opacity on the crown, let us consider first of all as this is air which is present in this area, that will allow more X-ray to pass compared to the lip. Lip is soft tissue, but again it will be shown on the X-ray because it will stop some of the X-ray, thus it will be more of a grayish rather than white appearance. So this is the shadow of the nose, and this is actually the shadow of the lip, and this part, this demarcates the end of the lip. So you will see here in this area a decreased radio opacity, which actually is the air which is present between the opening of the lips. So what we see here is the images of enamel plus dentine plus the air shadows which is present between the lips. While here we see the images of enamel plus dentine plus the shadow of the lip, which again, as we said, it will cast a shadow on this area. Another radiograph. This radiograph has it shifts toward the high contrast if it is compared to this one, which is of a lower contrast. And we will have another lecture about the what is the difference between a high contrast and a low contrast. Now let's have a look at this radiograph. Again, you will see here an area of increased radio opacity, while the lower part of the crown appears of a lower reduced radio opacity, because what you see here actually is lip plus tooth structure. Here you see air which doesn't cast any shadow plus the tooth structure which appears more radiolucent. Okay. Now in this area, this is another important area which I have talked about in the lecture about the caries. If you can go back please to the lecture of the caries or the video of the caries, you often see an area. See this area? I'll do it a bit back. This semicircular area over here. See, this line represents the root plus, which is composed of cementum and dentine, plus the bone or the socket which is covering the root. Now this line, the other line over here, represents the crown composed of the enamel and dentine plus the shadow of the lip. Of course here is also the shadow of the lip covering, but we can differentiate it here because of this difference. Here we cannot differentiate it. Anyways, so this area at the cervical portion of the tooth, this area has no enamel because this is the dentino-enamel junction over here. This is the enamel. Okay, all this is enamel. So this area has no enamel, it has only dentine and cementum, right? While this line over here actually represents the tooth socket which is composed of compact bone. You can see the socket. It starts from here. See this line, which we call the lamina dura, goes up, surrounds the whole root, and just next to it, or the inner part, there is a radiolucent line which represents the PDL. Now the socket of the tooth ends here at the alveolar crest. So what we see here in reality is bone, that is the socket, plus cementum of the root, plus dentine of the root, plus the shadow of the lip. What we see here is only cementum and dentine plus the shadow of the lip. What we see here is enamel and dentine and the shadow of the lip. So this area lacks bone and lacks dentine. Thus it will allow more, this area, this one, and you can see it also here, this area is devoid of or lacks, it's not covered by the socket of the tooth, and it is not covered by enamel of the crown. It's only dentine and cementum, so it will allow more X-ray to pass, so it will appear more radiolucent compared to the radio opacity of the root and the radio opacity of the crown. This area is called cervical burnout. Okay, cervical burnout. This area is mostly misinterpreted as caries or as reduction in the calcification of the tooth. Actually, it's a visual hallucination due to the different coefficient of absorption of structures covering the root and the structures covering the crown. Cervical burnout, it has a special implementation in sometimes it is mixed up with cemental caries. And I talked about it here. We said that in the lecture of cemental caries or root caries, I said that we will never have cemental caries unless there is tooth structure exposed to the oral cavity, and the only case where the tooth is exposed to the oral cavity is in cases of bone loss, that is in periodontal disease. In cases of healthy periodontium, where the level of the bone between the CEJ and the alveolar crest is 1.5 to 2 millimeters, we don't have root cemental caries, but we will have cervical burnout. So what we see here again, it's images of dentine, enamel and dentine plus the lips over here, while here you see images of cementum plus dentine plus bone plus the lips, which is in green here. This area has images of cementum and dentine. There is no bone, no enamel, what we call as burnout. It is more overexposed, this area, compared to the two area which we call as the cervical burnout.